Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. As you know, if you have a loved one, a parent, aunt, uncle, what have you, in long-term care, in a senior home or any facility like that, there's been a lot of worry. Are they getting the right care? And who's providing this? Who's taking care of my loved one? Who is actually doing the work, making sure that they're fed, they're bathed, they're just overall cared for? We've seen scenes where people have had visits through windows and on phone calls, FaceTime, Zoom calls, what have you, just so we can make contact with loved ones who are in long-term care facilities. And we've even seen across Canada, we have seen even some nightmare situations where people weren't being cared for, where workers just walked off the job. Well, British Columbia, it was probably one of the luckier places, and that the government started putting in regulations even for the private corporate models as well as for the provincial models of care homes to ensure that everybody was taken care of, everybody was taken seriously, so that we were able to curb the rate of infection inside the homes. And part of that was that our loved ones were locked away from us. Well, Adrian Dix and Dr. Bonnie Henry have shed a little light on that, and they've unlocked the door just a little bit so that we can have some visitations with our loved ones who are in long-term care. So there's a lot of rules and things that are going to happen around this. So I'm going to play the press release around this, and also some of the rules and the regulations that need to have happen in order for the long-term care homes to allow visitors. It's going to be on the BC CDC website, so I invite everybody to take a look at that if they're in British Columbia. And if you're not in British Columbia, maybe what has been modeled in British Columbia can help your community. So why don't we play the press conference where Adrian Dix and Dr. Bonnie Henry actually discuss what is going on. All right, here we go.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. Today we're talking about long-term care and visits. As you know, the situation in long-term care has been at the center of our COVID-19 pandemic. Indeed, I'd say the COVID-19 pandemic across the Northern Hemisphere. It's been an enormous challenge. I think people in BC, particularly our medical health officers, our healthcare workers, and those who support people with long-term care have done some extraordinary work. The rapid response teams, the early access to PPE, which made a real difference in BC. the exceptional efforts in infection control, the single site order, which has saw 8,848 people working in long-term care who are working at multiple sites be assigned to a single site. A level of testing that, especially at critical moments, was very high and assisted our efforts. One of the key issues, of course, is the decision that was taken in March to limit visits to residents in long-term care to essential visits. And like other similar decisions that have been taken, decisions to delay scheduled surgeries, for example, they're decisions which had consequences on all sides. Obviously, the level of vulnerability of people in long-term care to COVID-19 is high, which argues for ensuring that the tens of thousands of visits that happen every week be controlled and that we limit possible infection in long-term care. On the other hand, the extraordinary importance of visits to the life of people in long-term care, what they mean for people, what they mean for families, what they mean for friends, that it's not just about extending life but living life, and that involves engaging with the people that you love. People have done exceptional things to address these extraordinary circumstances, virtual visits and so on, but that question, the issue of visits in long-term care, is the one that when people email me or phone me or talk to me in communities, I hear about the most. And so we're announcing some changes to visits in long-term care, and with that, I want to introduce Dr. Bonnie Henry.
Thank you, and I do want to start by recognizing that we are speaking to you today from the traditional territories of the Lekwungen-speaking people of the Songhees and Esquimalt First Nations, and we're very grateful to be able to do that from this land today. It is also a pleasure to be here today. As we all know, the COVID-19 pandemic has put us all to the test, and this has been particularly the case with our elders and seniors in care. Very early on in this pandemic, we learned that our seniors and elders were most at risk of serious illness and death from COVID-19. Understanding this, we had to move quickly and decisively to protect our most vulnerable citizens. So to slow the spread of the virus, we made those most difficult decisions to restrict visitors in long-term care and assisted living, as well as putting in the single site restrictions right across the province. Despite our efforts, families have lost mothers, fathers, grandparents, and every day this weighs heavily on us. I have spoken before about the negative unintended consequences of COVID-19, the emotional and the mental costs, and I know that for many seniors and elders in long-term care, the impact of being separated from their loved ones. You have sacrificed more than many. I'm also very heartened by the resiliency that so many have shown to get through this so challenging time, and I am very grateful as well for the many notes that I have received from people in long-term care and assisted living and from their family members. There have been many dark and anxious days, but today is a brighter day for us all. Easing restrictions in Phase 2 and Phase 3 here in BC has been about finding the balance of continuing to protect British Columbians while lessening the negative impacts. And now the timing is right to do the same thing for our long-term care and assisted living facilities. It is the coming together of a number of different things that we've talked about in the past. The resources that we have in place now, the fact that we do have access to a supply of personal protective equipment, the number of new cases in our community is low. What this means is that visitors will now be allowed for long-term care and assisted living facilities. To start, residents will be able to have a single designated visitor in a designated visiting area in each facility. We are going to start slowly, and as we expect things will progress well, we'll expand these activities as we have done with every other activity. And we will be monitoring this on an ongoing basis to ensure that we can expand access as soon as it's safe to do so. We have set province-wide requirements that outline how facilities can allow visitors in long-term care and seniors assisted living residents. And like many businesses that have reopened, these facilities will need to have plans and precautions in place. Visitation requirements for long-term care and for seniors assisted living facilities include a number of things. One, that facility can't be in an outbreak right now, and those outbreaks are decreasing. We do have, unfortunately, 5 that continue, including some very serious ones that we know about. So visits in individual facilities will resume once each facility has developed the required written safety plan and has that in place, and they're working, even as we speak, with our local MHOs to make sure those are in place. That will include designated staff who can screen everybody who comes in on entry and who can provide the guidance that's needed to ensure that visitors are able to do so safely. Residents will be able to have a single designated visitor in the appropriate designated spaces, and there'll be both indoor and outdoor spaces, and in some cases in single rooms. Visitors must bring and appropriately wear a mask, and they will be trained on how to do that after their screening on entry. Visits will also need to be booked in advance to ensure that the spaces are appropriate and that visitors can be spaced out through the day so that staff are able to manage as well. In addition, we are also looking at and recognizing that people in assisted living are generally not as frail and able to direct their own care than people in long-term care. So what we expect is that people in assisted living will be able to have more freedom to go about having their visits outside assisted living facilities, but will need to follow public health precautions in doing that. In addition, we will have personal service providers, including hairdressers and barbers, will be able to come into long-term care and seniors assisted living facilities, but they will have to complete a plan, a safety plan that's aligned with the WorkSafe BC guidance and provide it to the facilities. And it will include such things as how they will provide services safely and ensuring that the names of each person that they're contacted is kept in case of an outbreak. So these guidelines have been developed in consultation with many different parts of our sector, and they've been posted they will be posted by today on the BC CDC website, and I encourage everybody to review those. Of course, we're all a little anxious because we know what can happen if we don't get this right. And it is something that has weighed on us and me as well over the last many weeks. But moving thoughtfully with care will give us the confidence that we need to move forward. And I know that this is what we can do here in British Columbia. It may take some facilities a week or 10 days to get all of the provisions in place, but I know they are working on it, and it will happen as soon as we can. So while I know everybody is very excited and anxious to see their family or their friends, please be patient for a few more days until we ensure that all the safety measures are in place. And I ask everyone to continue to do what we've been doing, to take things slowly and thoughtfully, to be cautious, to change your appointment if you are not feeling well. This will be so incredibly important. We know that communal settings with vulnerable people, that this virus can spread very quickly. So we need all of us to continue to follow our rules for safe social interactions and to ensure that we don't go if we're not feeling well. For residents of long-term care, I encourage you to limit your outings to essential activities, so things like medical visits. For residents of assisted living facilities, I also encourage you to limit your social interactions as much as possible, but to ensure that you do follow the rules for safe social interactions when you go out. And finally, I do want to let you know that we will review this on an ongoing basis, at least monthly, and as things progress in the community, as we continue to monitor cases, we will look at expanding how many people and how we can ensure that we are able to provide those essential care and visits to our seniors and elders. And to all of the seniors and elders in our care homes, thank you. This has been a difficult time for you, being separated from the ones you love, and for many people with things like dementia, it can be a very confusing and difficult time. You have shown a resilience, determination, and courage despite this challenge. As we move forward, We'll all do this well and carefully so that that sacrifice is not wasted. And we will also do it in the spirit that we have been all along. We'll be kind and be calm and be safe.
Thank you very much, Dr. Henry. And I wanted to note that those are important new directions in long-term care that will allow, for the first time for many people in months, visits to long-term care, one person per resident to begin with. But we know that at a practical level, and this is very important to all of us and to everyone working in the sector, all the residents, all their family members, it's important to ensure that we not just change the rules and change the guidelines, but provide the resources required to make it work. And that's why the province will provide more than $160 million for facilities to hire up to 3 full-time equivalent staff in each of BC's 680 long-term care and seniors assisted living residences, including both public and private resident facilities. This could total as many as 2,040 additional staff dedicated to ensuring infection prevention and control measures for COVID-19 are followed to support safe visitation. The additional staff will also work to schedule visits to make sure visitors do not enter the facility if they are sick, wash their hands frequently, practice respiratory etiquette, such as coughing into your arm, and maintain a safe physical distance of at least 2 meters from patients and staff wherever possible. In addition, the province will provide $26.5 million for facilities to address costs that they incurred between March 31st and June 30th, 2020, including additional screening, so only those approved to enter facilities do so, costs incurred due to sick time and self-isolation, costs for changes to services, i.e. delivering meals to rooms or staggering meal times to ensure physical distancing, additional housekeeping and enhanced cleaning, and infection prevention and control costs. This is in addition to the $10 million provided through the BC Care Providers Equip Care BC program in April to enhance infection prevention and control and improve quality and service safety in long-term care. It's also in addition to the costs associated with the leveling up in the single site proposal. In BC, that proposal has been implemented, but it's been implemented on a basis of equity, the only way that it could possibly go forward. It's our expectation that the monthly costs, and we'll be providing detailed costing of this probably as early as this Thursday, or a more detailed estimate than before, are between $10 and $15 million a month. Taken all of that together, plus the funding, the $240 million in funding to raise up care standards over the last 3 years, the implementation of Bill 47, getting rid of Bill 29, the hiring and training of new care aides, represents, I think, the most significant care change we are seeing and are in the process of seeing in seniors care in my lifetime. And certainly what we're seeing as well is the commitment of British Columbians, which I hear loud and clear every day, that they expect high standards in long-term care. I think all of the people involved have done well in comparison to other places. But we have lost almost 100 people in long-term care. We've lost a small handful of people who lived in assisted living facilities. And this, for me, and I know for all of you, regardless of how people do in other places, is too many and has a real consequence. And the people who have lived through that, the people who have lived through outbreak protocols, whether it's one person or 80 people who were affected by COVID-19 in those care homes, have felt the anxiety of that, as we do. And at the same time, we know, and it was fundamental in the effort to raise care standards in BC, fundamental, that people who live in care homes really have to, within the limits sometimes of their health, have to live well. And all of the actions we need to do to ensure that we not just keep people safe, but we have the opportunity to the maximum extent of freedom. And sometimes that freedom is extraordinarily limited for reasons of health. But to the maximum extent of their freedom, they live, and they live well. And that is what these changes are about. It is this discussion of how to manage visits is amongst the most difficult decisions right at the beginning and throughout. that I've ever been involved with. It affects my family personally. It affects tens of thousands of families across BC. As a result of decisions today, because there are 32,000 people in long-term care, there will be 32,000 more potential visitors. And we know what it means to them. We know how even the joy that sometimes can come with virtual visits cannot replace being in the same place with the people that you love, who you've been with your entire life. And that's why we're acting calmly and prudently and methodically to try and, to a maximum extent possible, keep people safe, while at the same time enable them to start to live better in this time of pandemic. Thank you very much for your time and for this important announcement, and we're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. If you have hit *1, please re-enter it to ensure your place. Please unmute your phones. You will not be audible until I call your name. You are limited to one question and one follow-up only. First question is from Marcella Bernardo, News 1130.
Actually, could you go to Lisa Yusa? She's on the conference call on behalf of us.
Next question is from Vinder Sejjan, CTV.
Your thoughts on mask wearing. So we're talking about having PPE when going to visit in long-term care homes, but as I'm sure you know, Toronto is voting today to mandate mask use indoors, and other Ontario cities have done so as well. Here in Metro Vancouver, the board says the cities would like some direction from you both before they look at bringing in mask mandates. So given that we're seeing this now playing out in long-term care homes, is this something that you're considering for other places as well, that mandating when people are indoors that they wear masks?
Yeah, so I think there's a couple of things around mandates around mask wearing. One is it depends very much on your transmission in your community. So I do not believe we're at the point where we need to mandate it, and I don't believe we have been there. Having said that, I do wear a mask myself, and I encourage and I recommend strongly that others do as well. When you're in those situations, particularly indoor situations where you can't reliably maintain your distance from others. So transit, we should be wearing masks. If we're going to small grocery stores where you can't always stay the distance apart from people, we should be wearing masks. And I do that, and that's the expectation we should have. There's no real benefit that we know of for wearing a mask outside if you're by yourself or if you're in a car by yourself. So those situations, it's not needed, but we should have one with us all the time so that we can wear them in those situations as they pop up. So yes, I do think it's an important layer, but it doesn't replace the other layers that we have that we know keep us safe as well. So there are circumstances where it is an additional layer that we will want to ensure people have. I'm thinking, of course, about airplanes, for example. And when we go to visit in long-term care homes, it's an extra layer because we know there'll be times when we can't maintain our safe physical distance. So there is no plan to mandate mask use here in British Columbia at this time. We may, if we end up in during the respiratory season with a surge, it may be become more directive that we will require people to wear masks in some indoor situations if we start to see a lot more transmission in our communities. But we're not at that point right now. Right now the focus needs to be on doing what we're doing, maintaining our safe physical distance, and having that extra layer of protection to protect others from us when we're in where we can't reliably maintain those physical distances.
Do you have a follow-up, Binder?
I do, yeah, and I just wanted to touch on that. If there is a resurgence in cases, is there a chance this policy, this visitation policy, could be rolled back, or is the intention to have at least one visitor even if the case numbers spike?
Yeah, so our intent is that we want to put in a policy, as we have with all of our Restart programs, and the whole purpose behind the plans that we have, the COVID-19 safety plans that businesses have, are to ensure that we can take those measures we need no matter what is happening. So I'll never say never. Absolutely, if we start seeing spikes in outbreaks in care homes, then we will need to revisit it. And this policy will be suspended in homes where there is an outbreak, because we need to take extra measures to reduce the number of people who are exposed in that environment. And we do have to remember that many of the people who visit in long-term care may be at risk themselves, either from medical conditions or from their own age. So we want to make sure we're doing the best we can to protect visitors as well as residents and staff. So there will be circumstances where this visitor policy will need to be suspended if we have an outbreak, for example. But our hope and our plan for all of the restart things, including this important one, is that it will keep us going over the coming 12 months or however long we need to.
Next question is from Richard Zisman, Global News.
Timeline there, 12 months that you mentioned, Dr. Henry. Is that what we're targeting here in terms of how long these restrictions will be in place? And what happens for loved ones? At what point may they be able to take someone out for a walk or out into a smaller community that's in long-term care?
Yeah, in long-term care right now, we know that the risk is greater when people are in other environments in the community, which is one of the reasons why we're looking at having specific personal service settings, services being provided in the care home, because it is less risky with a safety plan than having multiple people going out to multiple places. So yes, in the short, 12 months is an estimate. We'll see how long these are needed. Obviously, we want to have a treatment, an effective treatment or a vaccine, but we also want to make sure that if things are going well, we can expand this and have more than one visitor, so other family members can also be part of seeing their loved ones, or friends can be part of caring for loved ones in long-term care as well.
Do you have a follow-up, Richard?
I do, thank you. On what Binder was asking, I've heard from a number of bus drivers over concerns that people aren't wearing their masks, that we're now seeing an increase in the number of people riding public transit, and often means that there can't be physical distancing on transit. What is the harm? What would be the struggle with requiring a mask on transit? What's holding you back from doing that?
That is something that transit is expecting of people, and I expect of people. So yes, you should be wearing a mask when you're taking transit. My concern, and I've said this before, is there are some people for whom mask wearing is not a viable option because of medical issues, but primarily anybody for whom it's difficult to take it on themselves, so young children, people with disabilities, it can be very much a challenge. So mandating it makes it a challenge. I do think you should be wearing a mask if you're taking transit, particularly now, as you say, where there are more people taking transit. But we also need people who are more vulnerable, who are more likely to have severe illness. If you can't wear a mask in particular, you should look at taking off-peak times or using alternative methods. So we need to find that balance. Right now, with the levels that we have in our community, I don't believe we need to go that enforcement route with mask wearing, but I certainly wear one when I take transit, when I go into stores, and I expect others will too.
Next question is from Lisa Cordasco, CHLY. Lisa, are you there?
Lisa, your line is open. Please check if your phone is muted.
Thank you. Sorry. Minister Dix, could you please repeat what you had said before about the additional supports that are these being implemented specifically for this new visitation policy?
Yes, thanks, Lisa. I mean, first, if you think of visitation in long-term care, and over the years I've visited many people in long-term care and in acute care, but in long-term care, generally speaking, there is little staff assignment. You would go to a place, certainly if you knew the room number, and you would find the room number and visit the person. There were some limitations to that in certain cases, but generally the overall cost of the visitation policy was very little. Here, we're obviously mandating a series of actions to organize visitation and long-term care and to ensure a high level and the maximum level of infection control that we can pursue. So what we're proposing, for starters, is for facilities, the 680 long-term care homes and seniors assisted living facilities have the ability to hire up to 3 full-time equivalent staff to help implement infection control and to organize the visiting over the next year, as we see this issue facing us and being a challenge over the next year. Obviously, when you're providing limits and having a designated visitor, that requires more resources than it does with the more open system that occurred prior to COVID-19. In addition, and that's estimated to be up to $160 million, it's a very significant investment in infection control and long-term care and the quality of life in long-term care. In addition, we're providing $26.5 million to address costs for facilities to address costs that occurred between March 1st and June 30th. Many of those facilities, particularly nonprofit facilities, have seen real challenges in terms of the increased costs and increased demands of this period of COVID-19, of addressing issues around infection control, the fact that workers are sick and the need for sick time and self-isolation, and a whole bunch of costs to the way that services are provided. That's being provided as well. In addition, and previous to this, in April, as you know, there was the $10 million grant to Equip Care for essentially minor capital equipment to support infection prevention and control and other quality of life things in long-term care. And obviously the single site order, which will be more detailed about the exact costing probably on Thursday, but is a very significant monthly cost necessary to ensure our goals of infection prevention, but also serving to lift up the wages of people who are paid less in long-term care. And that's a significant cost, between $10 and $15 million a month. So that's a significant cost. And on top of that, we're in the third year of our plan to increase staffing levels across long-term care. As you'll know, there were about 75 facilities in 2017-18 that were more than 3 hours below provincial standards a week in terms of care per resident day, care per resident effectively, 3 hours a week below standard. There are 75 of those that are now 0, and we're obviously continuing, we're in the third year of that, to raise standards. So the infection control and visiting resources, the resources to support care homes in what has been a difficult period, the supports to provide equipment, the supports to implement the single site order. I think what's important is not just orders from public health, but the resources designed to improve the quality of care for long-term care residents across BC. This is what's required, and this is what we're putting in place.
Do you have a follow-up, Lisa?
Yes, I do. I'm just wondering specifically, with the designated visitor, is it always going to be that same person? And what determines whether visits will be inside, outside, or in the residence room?
Yes, to start with, we want one designated visitor to be assigned so that person can be trained on how to ensure that they know how to use the personal protective equipment, that they know the ways to do the visit safely. And it will be, each facility will work to determine how best to have visits within their facility. And obviously the people in rooms, it'll be around people, residents whose mobility is challenged, so that they may not be able to easily make it to another room, a visitor's room, for example. So we are looking at different ways. So it'll be slightly different depending on how big a facility is, what type of a visiting area they have. Some may have the ability to have more than one visitor at a time. We expect that. So these details will be worked out on a facility basis over the coming week or so. And then hopefully, if things go smoothly, we'll be able to expand that.
Next question is from Tanya Fletcher, CBC.
Dr. Henry, on that note, you said this will be reviewed monthly, but what would the criteria be to possibly expand those designated visits to others besides that single visit? Or say if, that one person has a small family, can the whole family go and see their loved one, if even they have to bring in more controls like remaining at a distance, but being able to do so in person at least?
Yeah, I think, with everything that we've done, we've sort of been learning as we go. We've never had to face this before in quite the same way. So we'll take advice from the sector, things that are working, things that aren't working, and look at how we can ensure that others in the family and loved ones of residents are able to visit as well. So I'm not sure exactly how that's going to look like, but I think there'll be lots of good ideas as we've seen with other sectors that have opened. We start small, as safe as we can, and then we expand given the experience that we have.
Do you have a follow-up, Tanya?
Yes, please. A nurse at the Lynn Valley Care Center has been fired for allegedly not donning PPE properly. Is there any indication that you know of that this is why the virus made it into the care home in the first place, or maybe how it continued to spread?
I don't know anything about those circumstances. I'm not aware of that. We do know that it's not only, many people in long-term care don't have the training around appropriately wearing masks and gloves and gowns. It's not the same degree of training that we have for nurses and physicians and others in hospitals, for example. So it was a learning experience for many people. There was a lot of experience that we have around influenza, but this is different than influenza, and we know that. So it was very much a challenge, and the training for care aides, for cleaners, for people who prepare food, for all of the workers in long-term care has been a dramatic learning curve for all of us over the last few months, and that is why we're taking things slow, making sure we have the personal protective equipment that people need and that they have the time to be trained to do it in a safe way, in a cautious and thoughtful way.
Next question is from Lisa Houston, News 1130.
Hi, Dr. Henry. I'm wondering if there's any consideration to testing people as they come in for these visits. I know there's going to be lots of people screaming saying we should test each time to make sure that people aren't infected before they go in.
The short answer is no. We've been looking at testing, and I know that's one of the things they have in place in Ontario. I think it's an added step that is not necessarily of benefit. We know that tests can be falsely negative, and that the parameters that we use around people who are asymptomatic and don't have any exposures, that testing is probably not warranted in those areas, and so we did have a broad discussion about whether that should be part of it or not, and our advice based on what we know about the tests and how they can be used, that it's not something that we need right now. What we do need is people to be fastidious about checking for symptoms, and if you're feeling at all unwell, to delay, postpone the visit, and make sure that you can get that visit done when you're feeling better. So that is going to be incredibly important. We have a screening protocol that's part of the guidance documents that will be coming out that is very broad, and we need people to pay attention to that. That'll be the most important thing right now.
Do you have a follow-up, Lisa?
Broadly, what is your biggest concern? I mean, this is a big leap of faith for the most vulnerable in our province. What is your biggest concern going forward with this step?
Yeah, these are the things that have caused me the most distress in the last few months, knowing that people who are in long-term care are at that point in their life where many of them have underlying health issues. Their quality of life is dependent on having family and loved ones with them. But we know that once this virus gets into those settings, the distress and anguish and fear that it causes both for the residents but their families as well, and the care providers, is immense. So it is that balancing that we've been trying to find of risk over time. I think we are at the point, and we've talked a little bit about this as we've moved into our restart phases, we're at the point where the risk in our communities is very low. It's not zero, And we know that, we've seen that. It keeps coming up in small clusters in cases, in workplaces, and where people are gathering. And we in public health have the resources to actively monitor every single case, make sure we find every single contact, and we have a process in place that we are confident we could do that. So we're tipping the balance now to the fact that the negative consequences of not having your family, not having your loved one, is starting to outweigh the risks. But it is a very fine balance. And, we need to make sure that we have these things in place, and this is why we're doing it so cautiously and so carefully. I mean, just the last 2 care facility outbreaks that we've had in Langley Lodge and then in Holy Family, just the devastation that it has caused for all of us, but particularly for the residents and the fear that they live with and the families not knowing what's going to happen. We need to avoid that. We need to do everything we can to avoid that. At the same time, we know that quality of life and caring for those who we love, and particularly, I think of seniors in my life, people with dementia, people who are at an end stage in their life. They need to have that human connection right now, and we are at a point where it's safe to do that. And I really can't overestimate how important, or how, the sacrifice of the people who have been working and living in care homes. It is because we've had these restrictions in place that we've been able to move in opening up other things in our society, in our economy, and finding that balance and not having lots of people going into care homes has been a really important part of that. But I believe we're at that balance, and I will admit that I am anxious, but I'm also hopeful. And I'm hopeful that it will be a positive experience over the next weeks. It'll be a challenge for all of us. It's like the first time we went to a restaurant or went outside. We want to make sure we're doing it right. So I want everybody to be thoughtful and to be cautious and to take a rain check if you're not feeling well, and know that that time will be there. And we'll get through this one as well.
And just one small thing in addition, this is going to be this process of people coming together and visiting is going to be itself a very moving and emotional process. It will have been, for many people, 3.5 months since they've seen someone they love, maybe someone they saw every day prior to that. And of course, people will change over that time, and it's very challenging in every possible way. So this is going to be this period. One of the reasons we're starting slowly is this period is going to be a very, very difficult one, emotional one, and challenging one. And it's why we're taking so much effort to provide the necessary resources. And the final thing I just say to everyone else, because this is a bit of a discussion with people who have families in long-term care or know people in long-term care, and the people in long-term care and the staff in long-term care. But everyone else affects this discussion. Our ability to keep flattening the curve makes people in long-term care and everywhere else less vulnerable. So we have to, as we're going forward tomorrow in Canada Day, continue to do the things we need to do to be physically distant, to not go to work when we're sick, to not go out when we're sick. All of these things that people have done, these small, tiny acts of kindness and generosity for months and months and months, that we need to ask you to do for months and months and months. They allow this to happen, and they potentially allow so much love and joy for people maybe you don't know, but who are profoundly affected.
Next question is from Daphne Brenlam, Vancouver Sun.
Daphne, your line is open. Please check if your phone is muted.
Can you hear me now? Can you hear me?
Go ahead.
Okay, thank you for taking my question. Many of the people I've spoken to who wanted to be declared essential visitors, they said that they would like to go in and help with the care. And I'm wondering if that's going to be possible, and whether these visits are going to be supervised and whether they're going to be time limited.
It will not supervise. We don't envision that. We envision some staff assistance so that people know what the parameters are. Right now, it's a very challenging thing to have people providing care for their loved one in the room, particularly if it's a room that's shared. So the start of this is making sure there's a safe space where people can visit and they can visit with their loved one, and it can be done in a more controlled environment. Yes, we do hope to be able to get to that point where we can have designated people provide time at the bedside or with their loved one in providing care in their room, but that is not at the point right now.
Do you have a follow-up, Daphne?
The other question that people have been asking is, under your first order, it said that volunteers would be allowed in. Will they be covered by this order as well?
Not at this point. We know that there's lots of important roles that volunteers play in long-term care. So it depends a little bit on what role they were and whether they're employees of the facility and what sort of services. So we know in some cases some have been involved in providing meals in a different way, but generally no, we're not talking about volunteers. We're talking about a designated family member or loved one to provide social support to individuals.
Next question is from Cindy Harnett, Times Colonist.
Hi, thank you, Dr. Henry. Kind of following on that question, is there a cap on the duration of the visit or the number of times one might be able to visit a family member in a week? And hearing of all of the cautions that you put in place, if everything went ideally, would August be too early a time to expand, or is that feasible?
I'll answer the second one first. I'm hopeful, yes, by August we'll be looking at that for sure to expand. Once we get into that routine, that seems to be how things are working, and as long as the rest of us are doing our bit and keeping community transmission as low as possible, then by August, absolutely. So we have not put in provisions in the provincial guidelines around timing or number of visits per week or anything like that, because we recognize it will vary practically by facility and by site and by what they're able to do, whether they're able to facilitate more than one visitors at a time, how big the facility is. So each facility will have to have a plan for how they're doing this, and we'll work with their local MHOs and environmental health officers to make sure that that plan works for that facility. So it may be different depending on the size of the facility, the resources they have.
Do you have a follow-up, Cindy?
I do. Thank you very much. We haven't talked about hospital visits, and there's the same desperation to have those visits. Would they be under this, or will there be a further announcement about that? What is the plan for hospital visits?
Yeah, so this does not include a visitation in acute care facilities. As we've talked about before, the majority of people in acute care facilities are in there for a much shorter period of time. There are provisions, as we know, for essential visits, and those are quite broad to make sure that people get the care they need. We will, of course, be looking at how do we support particularly people who are in acute care for a longer period of time. And that is something that will be forthcoming, but this does not apply to acute care. Yeah.
Next question is from Keith Baldry, Global News.
Hi, Dr. Henry, Minister Dix. Thanks for taking my question. As someone who has a parent in long-term care, I'm very aware of the multi-sided challenges you face here. And you sort of addressed this when you talked about balancing, but are you asking people to sort of accept that you're minimizing risk here, but you can't really eliminate risk altogether?
No, and that's a very good point, and we've said that all along. As we open up, as we have more contacts, as people move more, we are going to see more cases. And what we are hopeful for is by doing this in a measured way, we're not going to have more long-term care facility outbreaks. But the reality is that it may happen. And so that's why we're trying to do this in such a measured and cautious way. And, you know, we would... personally, we all that is what we all are trying to avoid, is making sure that we don't have another explosive outbreak in long-term care. So we'll be watching very carefully, we'll be monitoring very carefully, we'll have a very low threshold for not allowing anybody in if they're ill, but also testing of resident staff if we had any concerns at all. So that is something we in public health will be supporting care facilities around the province to make sure that we're doing everything we can to minimize that risk. But the risk will never be zero. And you know, when we look at people who are going to be visiting in care homes, we're asking you to reduce those risks that you're taking outside of that visit. So keeping your bubble small, not having large groups, not going out to places where you might have contact with lots of people. That's what we need to do right now. We need to continue to keep our physical distancing, our small numbers of contacts, doing it in a measured and thoughtful way so that we're not increasing the risk overall, and particularly not increasing the risk and bringing that into a care home.
Just on risk, Keith, just to put this in context, in the 501 care homes that were affected by the single site order, there are about 48,000 workers. There are more workers overall in the sector than that, if you include those not affected by the single site order, but that's that group of people. Then there's the 32,000 residents in long-term care, both public and publicly funded and private, and some essential visitors. So that's been the world of long-term care. And obviously, if you have 32,000 people and you have one designated visitor per person, you're adding 32,000 to that world. And so that's the reality we face and why we're spending so much in terms of resources here, because it means so much to the quality of life of residents in long-term care in terms of resources, but also that the rules have been put in place. And the most important one, and it's a reminder in every walk of life, don't go to visit if you're sick, not in any way if you're sick, not even think about it if you're sick, and the same in every other thing, but that's particularly true in long-term care.
Keith, do you have a follow-up?
Yes, on a slightly different topic. Speaking of large groups, tomorrow Alberta is moving to allowing gatherings of 200 people, which is 4 times the rule here, at a time when COVID cases are spiking in Alberta. Just what's your take on that? And can you see BC ever getting to that point anytime soon?
Anytime soon. You know, I've been talking with my colleagues about this. We've been looking at where we are seeing risks, where we are seeing things that allow transmission of this virus widely. And as we've talked about, it's a balance. It's a balance of having a large enough group that we can do what we want to do, but also that we can find people in public health when a case arises and make sure that we find all of our contacts in a timely way. So right now, it's 50 in BC. It's not going to change in the near future. We are, of course, revising and reviewing things as we go, and we've been working on, you know, how do we make it work, but still keep people protected, still have small groups, but ensure that we can support business and others to not be penalized by that as much as possible. So right now it's 50 and it's going to stay that way.
We have time for one more question. For any reporters that didn't get to ask a question, there will be a statement released shortly. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Adrienne Blanc, CBC Radio Canada.
Bonjour, merci de prendre ma question. Première question, on sait que pour l'instant, chaque résident a droit à un visiteur. Quand est-ce que les résidents pourront avoir droit à plusieurs visiteurs? Quelles sont les conditions?
On va commencer avec un visiteur pour une période. On va, au fur et à mesure qu'on commence ces changements, on va reconsidérer la situation. Mais pour l'instant, au commencement, ça va être un visiteur pour chaque résident. Et c'est pour des raisons de protection, bien entendu. La santé des résidentes, comprenant qu'il y a beaucoup de défis dans ces résidences actuellement. On a vu ce qui s'est passé à plusieurs résidences de soins au long terme, y compris Lynn Valley Lodge, Harrow Park et d'autres. Donc il y a beaucoup de risques. Il faut minimiser ces risques. Il faut donner des ressources pour assurer que des gens qui y travaillent, des gens qui sont résidents, des gens qui sont visiteurs sont protégés. Ça, c'est, à mon sens, essentiel. Et donc, nous avons un changement qui commence lentement, mais j'espère, et on travaille pour cela, qui va durer et qui va s'ouvrir envers plus de visiteurs, soit au mois de mars, au mois d'août, je veux dire, soit un peu plus tard que cela. Merci beaucoup. Thank you. And
Thank you very
we'll be
much.
releasing a statement at 3 o'clock. Oh, there's
No, there's the news releases coming very shortly.
Okay.
I promise.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.